Good afternoon, everyone. It's 1 o'clock, so we're going to go ahead and get started while we still have a couple people joining us. So good afternoon. Thank you for participating in our third stakeholder sharing session on community water fluoridation. For those of you that were on some of our sessions last week, some of this is repeated, so just hang in there. To get started, I wanted to cover some ground rules for today's session. Currently, most of you are on the session now as participants. However, once I'm done talking, I'm going to switch everyone over to a panelist so that we will all be able to see each other and hear each other, which will be better for conversations. If you are only joined on the phone right now, if you could just take a minute now to come off and introduce yourself so that we know who's here. And if not, you're also welcome to shoot me an email just so we can put the number with the name. So those of you that can see the screen can see that we are asking everyone to rename themselves so that we know who you are. And also we have everyone muted right now so that there's no background noise when people are talking. Throughout, feel free to unmute yourself to contribute to the conversation. To unmute in the bottom left-hand corner of your Zoom window, you'll see the little microphone, and that's where you can mute and unmute. If you want to just temporarily unmute, you can press and hold the space bar on your keyboard. So whichever you prefer. Also, once we switch everyone over to panelists, you'll be able to enable the grid view so that you can see as many people as possible. This is called the gallery view. So if you go to the upper right-hand corner of your Zoom window, it may say speaker view right now, or it may say gallery view. So that's where you can switch back and forth. If you don't see this, or it's not appearing and you're having issues, you can check back to the confirmation or reminder emails that were sent by Zoom, and they have some helpful hints and some links for you to check out. So, as you may see on the screen, we're asking you to introduce yourself. So if you could please type into the chat box your name and organization, that would be great. And lastly, just a reminder for everyone to keep our conversations relevant to community water fluoridation in Pennsylvania. With that, I believe all of PCOH staff and our intern, we're here, we're ready to contribute, and I am going to pass it over.
All right, thank you, Amy. Hi, everybody. Helen Hockey with PCOH here. We're going to give you guys a little bit of background on PCOH, as I know we have a handful of folks who are brand new to, maybe at their first meeting with our organization. So again, we apologize if it's a reiteration of something you've heard on a past session, but it'll be brief and quick. And then we're going to have our fluoride specialist, Mary Lynn, go through some of the information that PCOH is working on. And we've also invited a handful of other folks to share some helpful insights as well. And then we'll have some time for discussion. As Amy said, our goal is, of course, the discussion part. That's really what's most helpful as we're trying to forward these initiatives in our state. So with that being said, what is the coalition? If you're new to our organization, we're a statewide coalition, and we're made up of a ton of different advocates from all over the state. So we work with organizations and individuals that represent not just dental providers and insurance companies, educational facilities, community members, advocacy groups. We just pretty much try to work with everybody to talk about oral health. And we are one of many state oral health coalitions from across the country. So a lot of our work centers around the Pennsylvania Department of Health and their oral health programming. So we serve as a sole source contractor with that organization to help them implement and manage their oral health programs through federal grants. And we are a nonprofit. We have a staff of 3 that are all virtual remote workers from across the state here in the area. And we have a board that sits all around the state as well from a variety of positions. So focusing primarily on improving oral health for all Pennsylvanians from a public health approach. So issues like community water fluoridation are extremely important to our mission. I have a list here on the slides, just our basic 4 priorities. You know, we've had the same priorities for a number of years now, and they continue to be very, very important. We look at oral health workforce, which can include individuals from outside dentistry as well. So that could include a pediatrician doing some oral health services, or a community health worker helping to connect a community member to care. You know, we see that as bigger than just dentistry. And community water fluoridation, we're going to talk about today. You'll get your all the information you need there. And we do focus on sort of what we would call our most vulnerable populations in the state. So whether people are geographically vulnerable, you know, from a racial or ethnic minority, and you know, have greater health disparities than others, we really try to focus on any population that maybe isn't sort of being viewed with the health equity lens, and elevate their concerns. And then lastly, we wouldn't be a very good state oral health coalition if we didn't advocate for policy. So we do work with our policymakers in Harrisburg, as well as just at an organizational level, to make sure that people are thinking oral health about all of their work. And if you want to learn more about some of our other work outside of community water fluoridation, we encourage you to check out our YouTube channel, which has some recordings from past meetings and information that can sort of just give you an overview of all the stuff that we work on. So with that, I'm going to have Mary Lynn take over from here, as she is the fluoride expert, and she'll laugh, I'm sure, but she knows she is. So we're happy to have her serving in the role that she does with our organization. So she's going to tell you a little bit more about what PCOH does around community water fluoridation.
Okay, thanks, Helen. Can you all hear me all right? Okay, good. So I've been really looking forward to this. There are several of you on the call that I have been talking to on the phone, corresponding with by email and text, but we've never met face to face. So it's really great to put faces with the names and the personalities and the passion that you guys have brought. So this is just really, really exciting for me, and thanks for being here. So like Amy and Helen both said, really the really interesting part of this meeting is getting a chance to hear from all of you out there in the field doing this work, and to compare your experiences. So I'm going to spend as little time as I can providing just a little bit of a backdrop for what the situation is in Pennsylvania. So by the numbers, data, of course, is very important for everything. We're driven by the numbers, and we're trying to move the needle on the proportion of Pennsylvanians that have access to optimally fluoridated water. So the numbers we're working with right now, and I say it that way because this is a caveat, we're continuing to refine and improve the quality of the data that we're working with. But based on the best numbers we have right now from the Department of Environmental Protection, approximately 64% of Pennsylvanians whose homes are connected to community water systems are getting optimally fluoridated water. So if you add to that number the people who are served by private wells, then that number drops to 57% that are getting optimally fluoridated water. And to put that into national context, those numbers as of 2016 are 73 and 62% respectively. You may see those numbers shift in a downward direction as we continue to refine the data, and we'll qualify that as those numbers change because it's not necessarily reflective of rollbacks. It's more accurate data. Right now, we think the way that the the numbers are calculated is we're overestimating the number of people that are getting fluoridated water. Here it is put on a map. This map is, Helen, you might have to help me. I think it's probably 4 years old, about. Okay, so it's still pretty representative of what our situation is, but this is something that we are also planning to update as we update our data. But you can see that the blue areas are the areas that are fluoridated, and you can see that the fluoridation is concentrated in the more urban areas, right? You know, Philly, Pittsburgh, Harrisburg, Lancaster area, and a lot of the more rural areas, we don't have great access to fluoridated water. And oh, and I forgot to mention some numbers. We're looking at where we stand, where the nation stands, and where we're trying to go. The Healthy People 2020 goal was to reach 79.6% of the population on community water systems receiving fluoridated water. I just heard the Healthy People 2030 number yesterday. That's dropped a little bit to 77%. So we have a ways to go to meet those goals, but we have a great network in place to do great work. So looking at what we're trying to accomplish in 2020 and what we've accomplished so far, we have recently completed a state fluoridation plan, and that is in the Department of Health approval process. So once that's complete, we can make that available to the general public. And that will be both a guide for our work and a resource, both for public health folks and for water operators. For resources, we awarded mini grants up to $25,000 each to 7 different public water systems that wanted to improve, upgrade, replace community water fluoridation, totaling about $153,000. And those projects are underway now. We were delayed a little bit because COVID happened when we were in the middle of the process, but we are moving forward with that. As part of our work under a Centers for Disease Control grant, we are conducting a statewide inventory of water systems and what fluoridation equipment they have, what they think they're going to need to replace or upgrade so that we can get a cost estimate and hopefully come up with some additional funding to help more systems continue or even wonderfully initiate fluoridation programs. A big part of my time has been focused on monitoring and preventing rollbacks. Of course, we want to initiate fluoridation wherever we can, but we've had so many rollback threats that that's really where a lot of our time and effort goes. Of course, we are always working to provide public education so people understand the importance and the safety and the effectiveness of community water fluoridation. And simultaneously, we've been working to develop relationships with water operators and the statewide water organizations. I go to the statewide annual meetings of as many of those organizations as I can. So far, I've been to Waterworks Operators Association, the Pennsylvania section of American Waterworks Association, and the Pennsylvania Municipal Authorities Association. We've been trying to get into the Rural Water Association meeting, but that's a tough one to get into, and it's large and it's very well attended. So we continue to work on ways to connect with them. And last but not least, most of you probably know that this year marks the 75th anniversary of community water fluoridation. So we are promoting that everywhere we can. Okay, here's ag time, just a little bit. So many of you know that there are annual awards for water quality and efforts related to fluoridation. And this year, Pennsylvania was recognized nationally for 2 such efforts. Meadville, as many of you know and were involved in, initiated fluoridation last summer of 2019. That was an effort that started many, many years ago and actually was successful prior to when I began in this work, but they finally came online last summer, and that was just a huge accomplishment, and we're really proud to say that they are from Pennsylvania. And another award, this may be a surprise to Dr. Derry, Shippensburg was recognized for successfully defeating a rollback attempt. So again, we're very, very, very proud of that. Next slide, please. It's frozen on my screen. Advancing anywhere?
It looks like Helen is frozen as a whole.
Okay, can I share my screen and take it over from there, Amy?
Yep, you can.
Okay, let me.
Oh,
Helen, looks like Helen is back.
Sorry, guys. Technical difficulties.
That's okay. That's okay. Thanks for coming back, Helen. So the last slide that was up was the Shippensburg recognition for reaffirming their fluoridation program, which is fantastic. Pennsylvania got the attention of the American Dental Association for our work fighting rollbacks too. This is just a screenshot of an article that appeared last September where they recognized the work in Shippensburg, also in Corryville, and also in West Manchester Township. And this is brand new, hot off the presses, actually just confirmed this week. The American Fluoridation Society, who I assume all of you are familiar with, it's just a fantastic organization and a terrific support to our work and to work all over the country and internationally even. Because we've been so busy in Pennsylvania, primarily with rollback threats, we've leaned on them quite heavily and worked closely with them a lot over the last year or so. And they invited PCOH to become the state affiliate of their organization, and we were happy to accept that invitation just this month. So here's what has been going on in Pennsylvania that we've been keeping ourselves busy with for the last year. These are all rollback threats. So last May, 2 threats came up within days of one another in Lancaster County, Corryville Borough Water Authority, and in neighboring York County, Shiloh Water Authority in the West Manchester Township came up for a threat. Then just a few months later in August, Shippensburg faced a threat. February, Suez Mechanicsburg. This one is a little bit different and interesting because Suez is a privately owned water system as opposed to the others, which are municipally owned. And then just a few weeks ago, we learned about, I guess we can even call it a threat because it was done by the time we even heard about it. That is the Tri-County Joint Municipal Authority has already received approval of their application to amend their permit to discontinue fluoridation. So we are busy working, trying to find out what were the reasons behind that and what happened there. So with that, I'd like to turn things over for conversation. We have invited folks from many of these communities that have been doing this work to talk about their experience. And this is meant to be very informal. So even if we don't call you out to speak, please feel free to participate, ask questions, share insight, etc.
Donna, since I know you have some slides, do you want to go first? Oh, we can't hear you. Why can't we hear you?
Okay. Can you hear me now?
Yes.
Okay. Can you see any of my slides? Just screen share.
I'm happy to share them, Donna, if it's better for you.
I'm sorry?
I said I'm happy to share them for you if you'd like, because they're not coming up on our end.
Screen? Can we screen share?
Yep, absolutely. I have them right here, so we will. Technology is so much fun. Let's see. There we go. Now everybody should be seeing those, right? Okay. Donna, are you seeing them?
Yes. But I don't have control over the mouse, right?
Yeah, just
You have
let me
control
know.
of
I can start. I'll just let me know. Tell me to advance the slide and I'll make sure I do.
Okay, can you go back?
Sure.
I'm sorry, I'm just trying to get to this one view that okay. So you don't see my notes, right?
Nope.
Nope.
Okay, good. Okay. All right. So we're on the first slide, and I just want to thank you, everybody, for this opportunity to share and collaborate with all of you. PCOH has been extremely resourceful and helpful to me because this has been a learning process for me, as this is my first time with this. So thank you for your help with this, and yeah, so I'll tell you a little bit about my community water fluoridation process. And Helen, can you advance the slide to historical background? That up? Can you hear me?
Mm-hmm. Yep.
Okay. Okay. So just to give everybody a little bit of historical background, Helen, the first one should be the ABC 27 broadcast. Set up?
Yep.
Okay. So this is how I became aware of this rollback within Mechanicsburg district. Was a friend had told me that she had viewed this broadcast on ABC 27 that Suez was going to be removing the fluoridation from our system. It took me a little bit of time to track down where Suez was with this process, and again, Marilyn was very helpful with explaining the process to me. This particular situation was a little bit unique in that Mechanicsburg had sold their water system to Suez, which is privately owned. So it took me a little bit of time to track down where Suez was within the process. For those of you on the call that are unfamiliar, typically my understanding, what I've learned is that there's a permit application that takes place and then it's posted. And then typically there's a public meeting held for comment. There's also the public has to be notified, and how that notification takes place can vary. In this particular situation, it was a case where Suez had put a letter within their billing statement, and that's how they had notified the public. And then also once the permit was sent off to DEP, then it was posted on a PA bulletin, which that's something that I don't typically check. So the bottom line, there was no public meeting. Suez just slipped this notification in, applied for the permit, and here we are today. So Helen, if you could advance the slide, please. Okay, so when I had found out about this, it was broadcasted on the 5th, and then like when I looked to see when this permit was posted, it was on the 8th with a 30-day public comment window, and I was already at the 20th day, so I was in a little bit of a panic because I didn't know, what do I do now? So as I mentioned earlier, this situation, it's not owned by the municipality, so it's a private owned system. So we're finding that there's different channels on how to go through and with communication. Through this whole process, Helen, if you could put up the next slide. So the township had sold the water system to Suez about 20 to 30 years ago. So trying to find the contract on that and what was within the contract, as far as like we were wondering what the fluoridation clause may say, that became a challenge because no one could tell us, like, could produce basically the contract. Helen, if you could advance the slide. Thank you. So we were unable to locate that contract, and we did file a right to know with the township to try and hunt down that contract. They came back with basically a denial that they couldn't find the contract. Perhaps, you know, it's all paper back in 20, 30 years. Maybe it's buried in the basement in some boxes, wet boxes, and they didn't want to dig through it. I don't know what the situation was with that, or you know, they just couldn't find it. So we could have pursued that legally through the legal channels, but as a group, we just decided that we wouldn't do that. We would maybe circle back with that, mention that in the media, and then just move forward in a little bit of a different direction. Next slide. So what Suez has done that seems to have prompted the removal of fluoride from the water is they are in the process of merging with 2 additional systems. And those 2 systems that lie just around Mechanicsburg, Upper Allen Township, do not have fluoride in them. So the thought is that perhaps Suez would like to remove the fluoride from our district rather than add it, go through any kind of processes with adding it to the other 2. So to make things streamlined, perhaps that's their reason for removing the fluoride from the water. The letter that they had sent out to the customers, which took me a little bit of time to get, mentions, you know, some of the benefits and that there are other ways to get fluoride. Basically, it was just, you know, topical and some bottled water, and they suggested that there's no regulatory requirement to add it. So also within their letter, they never mentioned like how the public can respond to this. So it just, you know, appears that for seamlessness, perhaps that's why they want to remove the fluoride from the water. Okay, Helen, next slide, please. So where are we today? As soon as when I found this out, this possible rollback, obviously I contacted PCOH because this is their thing, and they're the experts with this. And then I reached out to 2 PhD HPs that are friends of mine for years, Cheryl Ross and Chastity Salzberg, and they both decided that, yes, we're going to fight this with you and we're going to do what we need to do. So they were amazing and digging up some information and resources. And when I had found out about this, there was also, I had found out that there was going to be a township meeting within 2 days. So both Cheryl and Chastity agreed to go with me to the township meeting to have a discussion with them on fluoride. And Helen, could you advance, please? Okay. So at this meeting, we were able to, again, have a dialogue with them, and we were able to convince the township to, whoa, let's put a hold on this. So they agreed to write a letter to DEP asking for that hold to allow time for public comment. Later on, I was able to go back a couple days later. Amy graciously put together these information packets that I could deliver to them, just so that the board could have some additional pieces of information that were science-based and, you know, explain the cost benefits and how it could impact our community. So that was one of the successes I felt like that we had. We were able to convince the township to put a hold on this. It's something that typically, like Mary Lynn had kind of suggested, it's not owned by the municipality, the water system, but certainly because they are elected officials, that's kind of the angle that Mary Lynn had suggested that we go to, because, you know, we need, as a resident, I could vote them one way or the other. Could you advance the slide, please? Thank you. So once we had that township meeting, we decided to expand our team. And I got some feedback there. We expanded our team. Mary Lynn had reached out to PDA, and Marissa and Dr. Rother and Dr. Alba joined our team, and they were amazing. Again, we just kept getting better and better. Could you advance the slide, please? So Dr. Alba and Dr. Rother and the three Amigo PhD HPs, we all went to a school board meeting, which again happened like to be the next day, thank goodness. I mean, not the next day, the next week. So thank goodness that worked out for us. And we were able to have another dialogue and convince the school board that they needed to write to DEP and ask for, whoa, let's hold on this. Let's have a public meeting and talk about this a little bit more, because clearly it's something that's going to impact the school for all the reasons that we already know. Next slide, please. And then we developed what I call phase 1 petition, and that was a boots on the ground, hand signing, knocking on doors petition. And the three Amigos, we went knocking on doors, and we were able to secure just over 100 handwritten signatures for this petition against removal of fluoride. It was also an opportunity to provide education within the community, and I really enjoyed that. Having a conversation, and I was expecting a lot of pushback from people when I was knocking on those doors, and I only had one person that was anti-fluoride, but I felt like our conversation was two-way, and in the end it was all good. It was valuable for me to hear her personal experience as well, and just kind of respond to that. So that was a good experience. And then we were able to also get some handwritten letters into DEP. Next slide, please. And there you go. So DEP, based on, you know, the petition and the letters that they received from the township, the school board, and some of the other stakeholders, they got back with Suez, and before granting, you know, approving that permit, they have asked Suez to hold a public meeting. And that's kind of where we are right now, waiting for that public meeting. Next slide, please. And part of that public meeting, we're trying to prepare for that and again, acquire more signatures on our petition. So Mary Lynn had devised an electronic petition, and so we've been able to get that out on various medias and social platforms to secure additional signatures. In particular, I really want to focus on Mechanicsburg people, the residents, and then any of the schools, pediatric offices, dental offices, you know, community people, people that work within the Mechanicsburg, Upper Allen Township, to support that and sign those petitions. So that's what I'm really trying to get a push for, that area. Next slide, please. So our education efforts are, you know, we're just trying to move forward with that through the petitions. And next slide, Helen. And media. Dr. Alba has decided to take on this piece, and he's been working with Dr. Johnny Johnson. Thank you for that direction and helping him, because this is all new to all of us. So Dr. Alba is working to secure some editorials, television pieces. We're going to go back to ABC 27 that initially sent the broadcast out, and then public radio. That's my big, I really would like to see public radio, not just talking about the this pushback or the rollback, but just promoting oral health. And right now we really need it. It's really important with what's going on with COVID. So next slide, Helen. Thank you. So ways that all of you can perhaps help is to share the link is here in the slides, and I'm sure Amy can send those off to you. If you could just, you know, share this petition, again, particularly within Mechanicsburg, because we want those numbers to be reflected within the petition. If anybody feels so led to write a personal letter, that would be awesome as well. Just keep getting that back out to the EP. And then if any personal letters are shared, I would just ask that you CC Mary Lynn so that we can keep track and we have a hard copy for ourselves as well. Next slide, please. So thank you for all you do with you, our neighbors, our colleagues. You know, I'm just looking forward to a future with increased community fluoridation, and that we continue to fight against these, for these, you know, rollbacks, these threats, and just get back up where surpass those 2030 goals for healthy people. Next slide, please. So thank you, everybody that is on this call, and thank you to my team, and hopefully it's just going to continue to grow. And if anybody is interested or, you know, hears of any rollback threats or areas that want to add water fluoridation, I would just encourage you to reach out to PCOH, because they are just been invaluable to me. And just if you haven't seen it already, check out PCOH's, the last newsletter that Helen posted had a lot of community water fluoridation resources and links into the ADA website, webinars that they're offering in celebration of the 75th water fluoridation. So thank you very much. I know I exceeded the 3-minute thing, so sorry about that. All right, thank you.
Thank you, Donna. Well, and Suez with Mechanicsburg is an interesting rollback because of it being privately owned, and so it's a little different than some of the others. You know, and with that being said, I know we have some folks from Shiloh and Shippensburg as well. So I don't know if anybody would like to sort of just give an update next on.
Can I, Helen? I have a nice segue.
Okay.
to both of those, and I did want to just add, and I know that we're trying to be cognizant of time here, but I wanted to mention another piece that our team has talked about, and Mechanicsburg is looking at the two systems that Suez Mechanicsburg is looking to consolidate with, to see if perhaps there is some interest and willingness in those two communities to consider initiating fluoride as an alternative to removing it in Mechanicsburg. We haven't gotten to that part yet, but that is something that we're thinking about and have some, you know, feelers out for who we might contact in those communities that would be willing to take up the charge. And another thing that we talked about with this group, this, you know, kind of came to a head right as the pandemic was ramping up. We wondered, well, gosh, with all of the attention on COVID, is this going to get lost in the shuffle? Should we wait before we start, you know, sending letters to the editor and circulating a petition and so forth? And one of the things we discussed is that, one of the unfortunate consequences of the pandemic is radically reduced access to dental care. And in a lot of cases, community water fluoridation is truly the only preventive measure that's available. So we found a way to connect it to COVID and went forward with that conversation. My segue would be, with this public meeting coming up in Mechanicsburg, and we don't know when it's going to be or how it's going to happen, but in both Shippensburg and Shiloh, the teams put together fantastic testimony at the public meetings. So I think Donna and the rest of your team, it will be really interesting for you to hear how they handled that. So with that said, either any of you, please feel free to take over. Or Helen will call you out. That's how that works.
Dr. Davis might be trying, but.
Hello, I would be happy to go next.
Okay, great.
Okay, my name is Kathleen Wagaman. Good afternoon, and thank you, Marilyn, for the invitation to speak. I'm a longtime resident of West Manchester Township, Shiloh, New York. It's located about 30 minutes below Harrisburg. I'm also a retired school nurse. And our local water authority supplies water to about 10,000 residents through the West Manchester Township Authority. And we've had fluoridated water for close to 60 years. Neighboring water systems to ours, as well as most all of them in York County, I think except for 5, all do not have fluoridation. Our story starts in early 2019 when several new move-in residents to our area advised the authority they did not want fluoridated water. The authority quickly made the decision to stop fluoridation without doing any research. But as of today, we still do have fluoridated water. Initially, our authority felt that they needed permission from the local township board of supervisors to discontinue fluoridation. Our supervisors asked the water authority to provide them with good reasons why they needed to stop fluoridation. They said, if you're stopping a service, you need a good reason to back it up. They also told the authority they needed to have a public meeting. The authority could not provide any good reasons to stop fluoridation. They held a public meeting, only gave the residents about a week's notice of the meeting date. Residents spoke at the meeting pro and con fluoridation. There was not an overwhelming attendance at the meeting. The township board of supervisors advised the water authority that they were not giving permission for fluoridation to stop. So we felt the issue was resolved. We didn't hear anything more from the water authority. But then late, around, I guess, the fall of 2019, the issue resurfaced again because the water authority found out that they did not need township approval to stop fluoridation. So this all kind of took place kind of suddenly, and the residents mobilized. The Healthy York County Coalition helped us, and Marilyn was a great help to us. Once again, it was really very frustrating. We took action. We had various meetings, but however, in late November 2019, the authority did send in the fluoride discontinuation amendment application to the DEP. During the 30-day open comment period that is allowed by the DEP, Our Township Board of Supervisors, as well as several residents, sent letters expressing concerns about the procedures that our authority use in their efforts to stop fluoridation. This did cause the DEP to meet with the Water Authority about the concerns in these letters. The results were that the Water Authority held another public meeting and also a public meeting where they met with the Board of Supervisors to try to resolve any concerns and communication problems. The Water Authority held these meetings because they felt it would make the DEP happy and then they could proceed with their amendment change. The Water Authority did say that they would take another vote on this issue, but this vote has been held off currently due to COVID, and it expects that the vote will take place next week. We do not know, at least at this point, if DEP has approved the application for change. So what's held us with fluoride to this point? I feel a very huge factor has been that our local government, our Township Board of Supervisors, did not support the Water Authority's decision-making process. The supervisors spoke out to the Water Authority. They published info for residents on their website and in the newspaper about their dissatisfaction with the authority. They expressed displeasure to the DEP in a very lengthy letter, and they did not reappoint an authority member to his seat at the end of his term at the end of December. In fact, at this point, the Board of Supervisors still haven't appointed anyone to that empty seat. Our authority is operating with 4 members rather than 5. And the authority told, the Board of Supervisors told the authority that they aren't rushing to fill this seat until the fluoride issue is settled. Additionally, the Healthy York County Coalition lent support to the effort in a calm, research-based manner, and Marilyn provided helpful advice and garnered support for us through her network, including phone calls, letters, news articles from the American Fluoridation Society. Residents spoke out at the meetings and sent emails, letters, and also made phone calls. But if fluoride is discontinued, there are some things I think really could have made a difference with our efforts. I really feel we needed a lot more outcry from the Water Authority customers. Overall, our 2 public meetings were poorly attended by water customers. The monthly Water Authority meetings, at least over the last year, have only had 1 customer in attendance. To me, the Water Authority meetings themselves are a crucial part in keeping fluoridation in the community. Seeing the Water Authority members in action gives a very clear vision of how to proceed. You can see their strengths, their weaknesses, their hidden agendas of every member. At our Water Authority meetings, it was always mentioned that the public has not attended their meetings. Customers haven't come to meetings, and they kept track of this in their minutes. Another thing that was very surprising to me when I attended the meetings was that the consulting engineer for the Water Authority very certainly played a very large part in influencing the board members to stop fluoridation. This sure wasn't something I expected to see, and I'm really not sure how that can be remedied. This person is not a voting member of the board. Additionally, in our township, the local township dentists and the schools have not become involved. But it's not over till it's over. Thank you for letting me speak.
Yeah, so there's so much there, and we could spend this entire hour on what went on in Shiloh and the politics. And we have learned so much about dynamics and really what is the chain of command and the hierarchy and decision making. And there really doesn't seem to be one answer. And excuse me, in Shiloh, what happened was the elected body, who was the Board of Supervisors, were in favor of continuing fluoridation. They appointed the water authority. So they were not elected officials, but they have ultimate independent control over what happens with the water system. So this was quite unusual in that you had these two in different positions. And this group's focus was on educating the decision makers, the elected decision makers. And as it turned out, the folks that had the influence there were the appointed officials. In Corryville, in Lancaster County, it was just the opposite. They put their efforts, and Dr. Tom Reagan had intended to join us and talk about Corryville, but he had something crop up and is unable to be here. But what they did there was they focused their efforts on educating the water authority, and did great work with them and had it to, you know, there were 2 in favor, 2 opposed, and there was kind of a swing vote. And that person indicated that personally, he felt that they should keep fluoridation in the water, but he acted at the pleasure of the Board of Supervisors who appointed him, and he knew that they didn't want it. So he voted to remove it. So it's, you know, it's a case of you don't really know who ultimately you need to influence. This has been just, you know, very interesting. But the, you know, the group in Shiloh has done fantastic work. And Sharon, we have not met face-to-face either, but I just wanted to say kudos for an idea that you came up with that we have replicated since then. The CDC scientific statement that they sent to your Board of Supervisors, your idea to read it aloud at the public meeting was fantastic. And I know that other communities have since done that when I told them that you did it to great effect. So thank you for that.
Marilyn, can I just make a couple of comments?
Yes.
Yes. Can you hear me okay? I think it's interesting that this is really democracy in action. And we did have, as Kathleen said, we didn't have a great turnout. We had about 50 people at each of those public meetings, and they were half and half, anti-fluoride and pro-fluoride. But it was interesting that it shows that our educational system is not what it should be, in that people don't take the time to really read or really study or really get involved. So I think it raises the question of relationship building, which is time consuming and hard. But I think if we go back to look at what happened in Shiloh, the manager, the gentleman who runs the pump house, and Marilyn had recommended that we go to the pump house. And so Sharon and her husband and Kathy and I went to the pump house, which was not particularly impressive, but doing the job, getting the fluoride in there. And he's a simple fellow and, you know, decent person and all that, but clearly listening to the complainers and then sway the board. And so it makes me even think that in these communities where we have fluoride, we should really become pals with those managers. And I don't know how you do that with, because you're a statewide coalition, and how you get volunteers and all these communities working. But I think if we had gotten to him first, he would have had an argument to these complainers and would have put it to rest very early on. So it's an interesting challenge. I do want to say, though, that your recommendations along the way were excellent. All of our communications, our letters to the editor and our letters to the public and our emails, and we did a lot of different stuff that you provided so much information. And Johnny Johnson was a great help. It was also really helpful that we were able to, Jenny Engler, the former chair of the Pennsylvania Coalition on Oral Health, was able to get one of her dentists from Family First Health to speak. And Dr. Mountain, he did a great job at this one public meeting in February. And then afterwards, we had a physician that I was able to convince to be there. And he had at one time practiced in Baltimore and now practices in New York, where they don't have fluoride. Mm-hmm. He got up there and he, in this very gentle way, this is Dr. Howie, a very wonderful man. And he shrugs his shoulders and goes, the internet's confusing. You read all this stuff and what do you believe? And then he said, well, I'll just tell you what I've witnessed. And he talked about the contrast. And I have to say that if we could have pulled the pulse of the the actual Shiloh Water Company people, they would have thought, why the heck didn't we do our homework here? Because he was very convincing. And we have a slight hope that they might not take out the fluoride. We think it's highly unlikely, but it's been a fascinating process. And thank you so much for guiding us along the way, Maryland. And I do think if there's more we can do around relationship building early on, we'd avoid these situations.
I think you're spot on.
Yeah. I had the privilege
Yes, go ahead, Eve.
of attending the water people's meeting with Marilyn. What, last year was it? Or year before? Anyway, it was the waterworks people. And I also then afterwards got to visit with our waterworks person here in Reading that I've been trying to visit with for 8 years. And I really think that those are the people that they are so grateful to have anybody in the public listen to them and ask them questions, because nobody ever talks to them. And they are powerful. I mean, you know, as you saw, they're the ones that dump the stuff in. And so I really think that was, it was very interesting, because Marilyn, when you say that we almost didn't, maybe we had counted one person that was anti-fluoride, but we sure didn't. It was a really friendly place.
This was, I believe this was the Municipal Authorities Association conference. So it was an audience of more than just water operators. There was water, sewer, but there were also, you know, municipal employees of all sorts there. Yeah, a lot of people stopped just because they're like, what are the toothbrush ladies doing at our conference, right? It's just a curiosity. We're not like all the other exhibitors. I think we had one person come up and really want to be confrontational. You know, he came out guns blazing and said,
yeah, but
I don't approve of fluoride. Do you want to argue? Yes, yes. So, you know, we were able to engage and have a dialogue. And to Deb's point, I think building those relationships is essential, and having people in the community, trusted people, known people like yourselves, who can do this on the ground is just essential. You know, me calling from a state association that they don't know, you know, I don't think that's going to have much of an impact. But hearing from people that they know and trust and that are respected authorities and their neighbors, that's really where you can start to make change.
Can I just add too that I'm with the Healthy York County Coalition, and unfortunately not every community has a coalition working around health issues, but if you do, they could be great partners if we have that relationship.
And you stole my theme, because that was going to be my theme, was relationships. I really believe that the success in Shippensburg was truly about relationships. And if you want to stop the rollbacks, then we need, you know, the pro-fluoride people to attend water authority meetings. We need them to be members of water authorities. I mean, you know, it's powerful when you have, you know, someone on your side serving on an authority. You know, I didn't really have that in Shippensburg, but we had a lot of relationships with our fellow citizens in Shippensburg that we knew, and we had no problem getting people, you know, to our public meeting. I mean, we found out about our public meeting only a week before it was scheduled, and I was worried no one would be there. And all of a sudden, you know, the second day after the notice, I started getting, I don't know, 20 or 30 phone calls a day. And a lot of them came from PCOH, from fellow dentists and hygienists in our area, and from local citizens who were concerned from Shippensburg University. So we had well over 50 people show up, pro-fluoride people show up for our public meeting. And it was just great. And I served on the Water Authority back in the 90s. In fact, in my group was a group that put fluoride in the water in Shippensburg back in the 90s. And so, you know, I had some experience working with the authority and working with government, and a lot of us just kind of shared our experience and asked questions. You know, what are your concerns? You know, and in Shippensburg there was 3 main concerns. One was DEP regulations. The second one was employee safety. And then the third one was cost. And so we just worked with, you know, the chair of the authority and some of the other members and went one by one, you know, helping them work through these issues. And, you know, we got help from other relationships that we formed in the dental community, like the Cumberland Valley Dental Society, which is our local dental society. The ADA and the PDA provided a lot of information. Someone talked about Marissa, you know, and the government relations division in the PDA. They helped us out a lot. The American Fluoridation Society, especially Dr. Johnny Johnson, he helped out, you know, an enormous amount and gave me a lot of information that I was able to share, you know, with the Water Authority. PCOH, I mean, you guys were amazing at getting the word out and, you know, getting concerned citizens to the meeting. You know, and we also talked to our, you know, it's not just a dental issue, but it's a medical issue also. So we talked to our medical colleagues, and we had a lot of physicians that came to the meeting and spoke about the importance of fluoride in the water. So again, you know, relationships that you have in your community, relationships you have with the borough authorities or the water authorities, you know, relationships we have with each other and other professionals, I think were really key in maintaining, you know, fluoride in Shippensburg. You know, and there's so many, you know, things to use. I mean, like the fluoridation facts, you know, booklet that we use. I mean, that really, we talked a little bit about education, but education without the trust doesn't work. It's just another, you know, just more noise there. And we were able to use, you know, that ADA publication and share it with the authority and show them, you know, different aspects, especially about the safety, you know, and ventilation, things that we could do to help them. And it just, I mean, their eyes just, you know, opened up and they were like, okay, now we get it, you know, we get it now. So it's like I said, it's really, you know, relationships with number one is the number one factor that helped us to be successful. Number two was just sharing the science and the facts with people. I mean, there's, like someone said on the internet, you get so much information. It's hard for, you know, these public members who are not scientists, who are not in the dental, you know, field, you know, that, you know, don't understand the science of fluoride and everything that's going on. So it was important to have that education for them. I also think that educating the community is really important. So getting the word out to the whole community so that you can get that support like we got at the public meeting is important. And then just making it easy for the borough authority or the fluoride authorities to make the changes. I mean, you know, we got a grant thanks to, you know, PCOH. I mean, the chair of the borough authority here has given me a couple phone calls thanking me for, you know, getting him in contact with you guys and getting that grant, because, you know, they're able to start to make some of the changes, and that, you know, cost was a concern that they had. Although when the community came out, they said, charge us more if you need to for fluoride, because we feel it's so important. I was really happy to hear that citizens say. It wasn't the dental people saying that, it was, you know, my neighbors and, you know, people down the street that were saying, no, it's worth it. It's for my children. I'm willing to pay, you know, whatever, a dime more, you know, $1 more, $10 more, whatever it takes to, you know, to keep my children safe. But we just made it easier for them. And we got a list of like FSA distributors, because they had an issue with their distributor only taking it, you know, the FSA to one location. They had 4 total locations. And so they had, you know, borough employees taking these big drums of acid in a pickup truck from one location to another, and they felt it wasn't safe. And so, you know, we helped them out, just, you know, listening to their concerns and then helping them solve those issues. And it was just teamwork. So I really want to thank everybody that was involved, because it was a, you know, it was a team effort to be able to maintain the fluoride in Shippensburg.
Yeah, that was, Dr. Davis, what you did that was so key, I think, and getting things going there was finding out what were the real issues, right? There's the official reason that they say they want to stop fluoridating, and then there's, you know, maybe some other things underlying it. And when you can find out what those are, you can begin to address them. finding out about the financial struggles and being able to connect them with grant funding was a result of your conversation, and also the issue with the FSA drums and what was being required of the water operators. Sorry, I was distracted by a chat, and I'm glad to see it. Because when you told us about that, I reached out to Tracy Beamer, who's the fluoridation engineer at CDC, and told her about that. And she was the one that tracked down some other suppliers for you. And Tracy just offered to speak. So Tracy, I'll let you chime
she's
in
on the
here.
call now.
Yes. Yes.
Hello, everybody. Thanks for letting me listen in. This has been great and enlightening, and it sounds like you guys are all doing some super great work in Pennsylvania. So, but yes, to get back to what we're talking about as far as just the supply issue, Marilyn, remind me again. It was, or Gary, remind me again what the old supplier was making. They had to take the drums and then they had to take the empty drums back themselves. Was that the deal?
They had to take the full drums from their one loading dock out to, I believe, 3 different wells, load it on a pickup, unload it themselves, and additionally, they would not take back the empties.
Right. That was
that's
Is that right? Yeah.
Yep.
Yeah. So I actually and actually you can actually look it up on the NSF website. They actually have a list of all the fluoride suppliers throughout the U.S. that are NSF certified, which needs to be done for the chemicals. But at the time, I actually reached out to one of the manufacturers down in Florida who was able to point me in that direction, and then also be able to get you some more suppliers. Did they end up changing suppliers? Was that the outcome of it? Oh, that's great. That's great. And that's just crazy what they were making them do. I can't even imagine. But I do want to say, just in generally, and I talked to Marilyn quite a bit too, but if anything ever comes up, I know you're all dealing with your current rollbacks, but if you ever need anything, feel free to reach out to me directly as well at any time if you need to. So.
I think something too, I just wanted to mention, since I know some of the folks on the call haven't been intimately involved with the rollback, and I don't think we mentioned the direct numbers, but we've got, over 2,000 public water systems in our state. And at this point, Mary Lynn will correct me, 193-ish are
190-ish, yeah.
Ish. Are providing optimally fluoridated water. So if you look at that straight number, you realize that there's a lot of work yet that we can be doing. That's close to 2,000, water systems that we could be communicating with about the importance of water fluoridation. And it's a lot of potential. I think rollbacks are so important because they've already done the hard work. So preventing rollbacks, like for a community that's already done the work, they've put in the equipment, they've done the permits, like let's keep them going. Like don't backstep. But we also want to look. So I think, something else I would just like to say for those on the call is if you're working in a community that hasn't done this already, and you have ideas, we've had teams sort of self-assemble in the past to sort of reach out to their water authorities and talk to them. And just, I think the mention of touring the facility is really, really important because really, these individual water operators, they want to be seen and they want to be heard, and they're doing some pretty crazy stuff to keep safe water for everybody. So we need to be appreciative of that. And I think that opens up the conversation then.
Yeah, I feel like we don't have to reinvent the wheel each time something happens in a new community. We have experience of others, and and I reached out to people like Dr. Johnny Johnson and you guys, and people in the ADA that have had the same experience that we had. So it's good to have those relationships and know that there's a list of people that you can contact. And of course, if anybody ever wants to contact me, if they have a rollback, I'd be happy to share even more information. I could probably talk for, 10 straight hours on all the different things that we talked about. But yeah, I really believe it's about relationships. And I think, if we want to be proactive, we really need to get members, or not only members, but pro-fluoride people to the, water authority meetings and on some of these boards. We need people on the boards to serve. That's the best thing we could do.
Absolutely. Eve, I don't know if you want to address the kind of work that AAP has done around fluoridation. I know the American Academy of Pediatrics has been really, really a great kind of voice from the medical community.
We've been, well, we got funding from DentaQuest here in Berks, in Pennsylvania, to teach physician offices the importance of oral health and fluoride in the water. Nationally, the American Academy of Pediatrics has a whole bunch of grants, and they have a website called I Like My Teeth. Is that what you want me to talk about, Helen?
Well, that, and just that, I mean, they have all new videos out. I mean, they just put the new little video ads out talking from pediatricians talking about the importance of water fluoridation.
Right. And they have a weekly email that emails out they follow all over the US when there's a rollback going to happen. And they send out an email. Problem is that I don't know if it gets to the people that it should get to, because in my opinion, and Gary, you alluded to it, well, all three of you alluded to it, that advocacy is local for when you come to something like this. You bring in, for me to come to Shippensburg would mean nothing, and might even be negative, because it's one of those outside people putting stuff onto us. So getting things to the local people is still a challenge. But the Academy does have a whole lot of resources, handouts and things that communities can use when you do get the community to support and need resources. Hollis Rossinoff is the person who's heading that right now. They had a little bit of a staff cutback, so she's got 2 jobs now instead of 1. It's a good source of help, of materials. And probably the best place to look at is the I Like My Teeth website, or to go to the aap.org and /oral health. There's a whole passel of resources there, and they've put together a new instrument that crosses across fluoride and in the water, and fluoride varnish and brushing teeth and all kinds of stuff. So it's a good, if you want to spend 20 hours, lots of stuff there. Or if you just need a specific thing, you can probably find it there.
Yeah. And I know we also wanted to, I'm going to just share my screen real quick. We mapped sort of a map of Pennsylvania, and the little blue dots there are sort of the rollbacks that we've seen over the last 18 months. So there's a handful there that we didn't mention previously. And some were prevented, some went through, but you can see, I don't know, Mary Lynn, if you want to speak to that, but I did actually put the fluoridation map sort of next to that. So if you look at that and you see that it is definitely the southern tier that is offering optimally fluoridated water, and then we move back to here and we would expect to see, that the rollbacks are mostly in the southern tier area.
Yeah, so, and one thing that I think is kind of interesting is Lancaster, York, and Cumberland counties, which we've talked about today, the most recent rollback attempts, are all in the same DEP region. I think most of you know that permitting for, at least for water operator purposes, happens on a regional basis rather than a central office. So you're dealing with different offices and different engineers in each region. And I've learned that they have a lot of latitude for how they handle permit applications and enforcement, but this poor engineer in the South Central region has heard a whole lot from fluoridation advocates recently. The two in Cambria County, those are Evansburg and Johnstown. And those, I believe they preceded my work in this, Helen. Do you have anything you can share about those?
Yeah, so Johnstown was a big loss for us. That was a very big water authority that ended up discontinuing back, I want to say May of 2018. And then Evansburg was a win. They had brought it forth to the board, and there was enough community support, particularly from the local dental association, that they were able to stop that rollback from happening. So we were considering that to be a great win for that area. And I think the only other one we haven't mentioned is Franklin, which is up in Venango County. And some of you may have seen that was an unfortunate incident where there was a mistake on the part of the system, and the water was over fluoridated for a number of days. So really that was a tough one, because it was very highly publicized, but that is one where they're no longer fluoridating.
This is
Helen,
even.
oh, sorry, go ahead.
Oh, no, I just was, Helen, you caught me unawares with asking me to talk a minute ago, because I was looking under under my water's fluoride, because I forgot the recent data. My county is Berks, and there are 75 water suppliers in our little county. Of those water suppliers, 9 are fluoridated. The problem is that a whole passel of them are wells. And so my hope is that now that we're getting the ability to fluoridate smaller units of service, that maybe we can, and we have some funding for them, maybe we can start working on those. But that's yet another kind of barrier. Is across Pennsylvania, we have a lot of wells, right, Helen?
So, you know what? I'm really glad that you brought that up when Tracy is on the phone, because wasn't there a water system at your public meeting in Berks that said they can't fluoridate because their source is groundwater?
Yes.
They said they can't fluoridate wells?
Yeah.
Yeah,
And I told them that was wrong.
That is absolutely not a true story. Tell them to come down to Georgia. We'll show them lots of wells that have fluoride. But yes, with the new tablet system coming out, which I don't know if Marilyn has told you all about, it's basically built for smaller systems. It's going to be much easier to operate and to handle the product. As far as the fluoride product, we're hoping that it's going to be a complete game changer, as far as getting some of these smaller systems fluoridated, or even maintaining some of these small systems as well. I think it's really, when it comes to some of these wells, it's just having the space, if they don't already have it, to put that equipment in. But otherwise, it's going to be a pretty easy and simple process. So hopefully, fingers crossed.
How much space do they need?
Well, oh my goodness. I'm trying to put this in I would say for a very small system, I mean, we're talking, it's basically like a pallet size That's the size
Okay.
of the whole entire system, at least as far as the new tablet system goes.
Yeah. Okay.
And that's really all the space that you would need. You just need to be able to get it some of the plumbing done. But other than that, as long as they have a constant flow, that's all the space that they will need. So, and then, you know, there are other options too. If they wanted to use, let's say, like a saturator for a well system, that's only just like the size of a 50-gallon drum many times. So
Where is the best place to direct people that have a really small system like that?
as far as to look at equipment or to...
For advice about what to do. Yeah, equipment, how to do it, costs.
Yeah, I mean, they can reach out to me at any time if they need to,
Okay.
because I have a lot of that information, or I can probably also guide them to maybe somebody a little locally that could probably give some better pricing and things like that as well.
Okay. Can you put your contact information
Yes, I
in the
will
chat
do that.
box, please? Thank
Yes,
you.
will do.
Oh, there it is. You
Yeah,
see
so
Helen's
just
screen?
share this one is still being finalized, so it's not available for purchase yet, but this is that system they were talking about, you know, whereas old systems had to be in like this huge big room and took up all this space and it was crazy, that these new systems to fluoridate water, you can see they just put a tablet in and it, as the water goes through, it fluoridates. I mean, it's so, we'll say simple, at least compared to, you know, some of the other systems that they could have. So even for a system that serves 5,000 to 10,000 residents, you know, the estimated cost for this is really, other than permits and things, I'm saying just for equipment, is just a few $1,000s. So, you know, that, and it's only a few $1,000s a year for the tablets as well. So if that even. So this is a great option when it's available for systems that might be interested.
We have
Yeah, I have one caveat about talking to systems about that is let's make sure that we've touched base with DEP about their understanding of approval for it before water systems start paying engineers to look into it only to find out that they can't get it. I say that because that has happened, and it was unfortunate because a local response team that did that lost some credibility with the system that they were talking to, because they said, hey, you've got to go try this new system, and they worked with an engineer. The engineer took it to DEP, and DEP came back and said, this is not approved yet. So,
Marilyn,
Tracy,
was that,
I don't know
was
if you
that for
can,
the tablet system?
Mm-hmm.
yes.
It was? Oh, wow.
Yeah, that was in Coreyville.
Gotcha.
And I have put Steve McCarter directly in contact with Central Office at Safe Drinking Water Bureau. And what they came back with is that was when they had to redo NSF 61 because of a supplier change.
Yes.
So anyway, I would just want to make sure that we know where things stand as far as DEP is concerned,
Yes,
because they're the
100%.
ones that are going to have to approve the permit. Yeah.
Agreed.
So how do we make that happen? Do we have to talk to KC Industries and have them send something to DEP, or?
Yeah, they will have to talk directly to DEP, and probably actually they will have to, usually there's a separate permit for new technologies that they will have to weed through that process as well. Marilyn, I don't know if they mentioned this on the call yesterday, now when I'm thinking about it, but they had already done pilot testing in Florida and Georgia and Colorado. However, they are now having NSF do a round of pilot testing for them in the hopes that that will carry more weight with the states when they start getting approval, that NSF had done the testing as opposed to just the localized pilot testing in some of those states. And yeah, so, and I think that kind of got held up a little bit, obviously, because of COVID, but I think they're planning on moving forward with that this summer. So, you know, whenever that is finished, I think is really when they're going to start marketing widely nationwide.
Good to know. No, I don't remember hearing that on the call yesterday. would love to have a pilot site in Pennsylvania.
Yes.
Everybody would, right?
Yeah, yeah. And I think we've even told Steve that from Casey Industries. Like, we even had given him some names of different, you know, municipalities and things, and said, here, you know, please. So if you want us to be guinea pigs, yeah, bring it on. We'll take it.
Exactly.
Oh. So I know we're coming short on time here. I want to make sure, I know, you know, there's so much information that could be shared around community water fluoridation, but if anyone who's joined the call sort of has any pressing questions or concerns, you know, and wants to voice them to the group now, now's the time.
Helen, will you be sharing everybody's contact information? Will you be able to share contact information?
We certainly can. If there's anyone, I would say if there's anyone on the call that does not want their contact information shared, they can let us know that. But, you know, I think if everybody's sort of in agreement that that's okay for names and emails, I always hate to do that without explicit permission.
No, it's fine.
Yeah, I'll tell you, Shippensburg and Shiloh, you guys, if you're willing, you could be a tremendous help to the group in Mechanicsburg, because we are very fortunate to have had so much notice before a public meeting. We didn't even expect that to happen, but efforts worked with DEP to require that. So we have the luxury of this time, and we'd like to make good use of it to do what's worked.
Donna, do you have all of the school board members on board to write and appear?
One of the administrator, he actually he said that he would like to appear.
Yeah, but you need to get all the
So,
school board members to come. You need to contact the president of the school board and tell them they have to come.
Yeah, I plan to let them know when the meeting is and encourage them to attend. I know for sure one gentleman has already said that he would attend. And then I plan to reach out to the township as well and let them know.
Mm-hmm.
Great. Yeah.
Maybe some teachers too.
Yeah. We really appreciate everybody being passionate about this. It's such a subject to talk about.
Get the parents there. That was powerful.
Right.
The parents.
Parents of the kids.
Yeah.
And the school board members can guide you to people to parents that supported them when they ran for school board. Because it's still an elected office in Pennsylvania.
Well, I know I've said it before, but I can't ever thank all of you enough for all of your time and energy and passion and persistence. This work in Pennsylvania just wouldn't happen without the local response team. So I appreciate you so much.
And thank you guys. If anyone has not already been involved with PCOH, feel free to check out more information and sign up for our newsletter, and we can keep you posted on some of these things. And I know our community water fluoridation task force, if you're not an official member of that already, Mary Lynn can help you with that too. So reach out to her, and that way we've got all the people we need. So thank you guys.
Thank you.
All right.
Thanks, everyone.
Yeah.